Good day, ma'am. I am your student nurse Marimar Cabigas from BSN 1C. At this moment, I am going to demonstrate to you on how to prepare a medication from a vial and ampule. So first, let's all gather all the equipment that we will be using for the preparation. The medication syringe, the vial, and the ampule. Then check the medication order against the original order in the medical record according to facility policy. Then know your actions, the special nursing considerations, the safe dose ranges, the purpose of this administration, and the adverse effects of this medication to be administered. We need also to consider the appropriateness of this medication for this patient. Then, we need to perform hand hygiene, move the medication cart to the outside of the patient's room or prepare for the administration in the medication area. Then, unlock the medication cart or drawer, enter passcode, and scan employee identification if required. Then, prepare medication for one patient at a time. Read the medication administration record and select the proper medication from the patient's medication drawer or unit stock. Then compare the label with the medication administration record. Check the expiration dates and perform calculations if necessary. Then scan the barcode in the package if required. Then remove the metal or the plastic cup on the vial that protects the rubber stopper. Then wipe the rubber with the use of antimicrobial swab. Then wipe it at least once. Then allow it to dry. Remove the needle cap by the use of our non-dominant hand by pulling it straight off and hold the plunger at the knob only. Then, we need to instill amount of air. Then remember that the amount of air in the syringe will be equal to the specific dose of medication to be withdrawn. We're going to hold the vial on the flat surface and we're going to insert our needle tip on the vial. Then, we're going to inject the air into the space and not on the solution, this to avoid producing bubbles. Invert the vial, hold the vial in one hand and use the other hand to withdraw the medication. Then touch the plunger at the knob only and we can withdraw the prescribed amount of medication while holding the syringe at the eye level. If there's any accumulation of bubbles into the syringe, we can tap the barrel and not on the hub area. Then push the air into the space and not on the solution. Then pull the amount of the proper dosage of the medication. Then remove the needle into the vial. Then place back the needle cap. Then, we need to check the amount of medication into the syringe with the medication dose and discard any surplus. Then, we need to recheck the label with the medication administration record. Then, lock the medication cart before leaving it. Perform hand hygiene. And proceed with the administration with the prescribed route. Then, for the ampule, we need to shake it first with the 8 figure or shake it like this while holding the ampule vertically. Tap the stem of the ampule, then wrap it with a gauze pad and break it away from the body to prevent injury. Then, remove the needle cap by pulling it straight off to prevent needle stick injury. Then, withdraw the medication ordered plus approximately 30%. Then, make sure that we can instill air into the solution and make sure that the needle wouldn't touch the surroundings of the ampule to maintain the sterility. Then, withdraw. We can do this also at the eye level. And if there's any accumulation of bubbles into the syringe, we can tap the barrel and expel the air by pushing the plunger. Then we can place back the needle cap. Then, we need to check the amount of medication into the syringe with the medication dose and discard any surplus. Then, we need to recheck the label with the medication administration record. Then, lock the medication cart. Before leaving it, discard the ampule in a suitable container. Then, perform hand hygiene. Proceed with the administration with the prescribed route. That's how you prepare a medication from a vial and ampule.